My name is James Trost, and this is A2 Insight. Today's guest is Trish Cortes, the Executive Director of the Washtenaw County Community Mental Health. Trish Cortes, welcome to A2 Insight.
Thank you. It's a pleasure to be here.
Well, we're very glad to have you here. If you could just start out by giving me some information and our viewers, your background, where you grew up, how you ended up in the position you have, and just information about your family, and so we can get to know you a little bit better.
Sure. So I actually grew up in West Bloomfield, Michigan. I am actually first-generation American. My family is from Spain, so I grew up in a Spanish-speaking household. I am married and have twin 10-year-old boys. In terms of how I got to where I am now, I went to the University of Michigan School of Nursing. I also did my master's program there. But right after graduating from Michigan for my undergrad program with my nursing degree, I moved out to Boulder, Colorado, where my first job was doing home care nursing. And through that job, I started working with the Medicaid population, and which was my introduction to working with adults with intellectual and developmental disabilities. And I just loved the work. I loved working with that population. So shortly thereafter, I ended up working for the equivalent of community mental health in Boulder County. And then when I decided to come back to Michigan, my husband and I came back to do our graduate work, is when I started working for Washtenaw County Community Mental Health in 2000. And I started as a nurse, became like a supervisor, program administrator, then did some work around integrated care initiatives that we were doing here in Washtenaw County, and then eventually am here now as the executive director. So I've been here for 17 years.
17 years is a long time. Could you give us a little bit of a history of just the whole concept of community mental health? What did it grow out of, and its origins here in Ann Arbor? What is community mental health, and where does it come from?
Sure. So community mental health is actually President Kennedy in 1964 signed into law the Community Mental Health Act, which really thrusted the nation into deinstitutionalizing individuals with developmental disabilities and mental illness out of state hospitals, and really moving the treatment around those services more into the community. So here in Michigan, it was in the early 70s where that work started, and it was first administered actually by the state, directly operated the mental health services, which then changed in the late 70s. That work and that governance and administration of mental health services actually moved to local counties. So that's and then on a financing end, what also changed was in the 90s, the state of Michigan moved to a managed care financing model, which then kind of separated the specialty behavioral health dollars away from the physical health dollars, and created prepaid inpatient health plans. So PIHPs is what we call them across the state. And I think they started with 18 in the late 90s, and then in 2014, those consolidated to 10 PIHPs in our state. So for us in Washtenaw County, we are in what they call Region 6, and our affiliate partners are actually, we work in partnership with Lenawee, Livingston, and Lenawee counties.
Oh, well, that's interesting. So it's mainly a federal program through the Medicaid, but it's administered locally.
Right. So the dollars, there's a federal match, then brings it to the state, and the state then allocates the Medicaid to each of the prepaid inpatient health plans that then allocate to the 4 counties. So that's kind of how the financing works.
Well, when the term, I guess, community mental health is fairly broad. What are the actual populations you serve? What are the need for your services, and what are the target populations that you are working with currently?
Sure. So we serve roughly about 5,000 individuals in Washtenaw County a year. We serve adults with severe mental illness, youth with serious emotional disturbances, and youth and adults with intellectual and developmental disabilities. So that's the target population. We're a Medicaid-funded program, so we do the vast majority of the work that we do are for individuals that meet those criteria, but that also have Medicaid. And I think what kind of sets community mental health aside, which I'm not sure that folks, unless you know something about community mental health, really realize, is that the array of service that community mental health provides is far beyond what traditional insurance covers. So traditional insurance covers psychiatry, some therapy, sometimes some nursing, but that's really kind of what you're entitled to under a Blue Cross Blue Shield type benefit. Whereas community mental health, we obviously do that, but we do a much more broader array of service beyond that. So we do a lot of things around employment, case management, housing, getting people hooked with what they need. So community mental health does far beyond just what many individuals would just consider to be like typical treatment.
Well, this actually just brings up something I thought about as it relates to the whole concept of insurance and how that, this is a new question. Let's, if your traditional policy covers a variety of services and you're serving a Medicaid population, there are probably people who aren't eligible for your services based on their economic status being too good. Now, is that a reality in your world? Can you expand upon that a little? How does that? Where do they go?
Well, that's one of the big challenges that we faced in Washtenaw County was in 2014. We had a significant funding cut to what we call our state general fund dollars. So while we've always had the bulk of our funding has been Medicaid, we did used to get some funding from the state that we call general fund, and we used to use those dollars to actually serve individuals who, the progression of their illness has become so severe that they diagnostically might look just like somebody that we typically serve, yet they didn't have the benefits. So we used to actually kind of anybody who just kind of met our diagnostic type criteria, we used to be able to serve in through our services and kind of provide that whole array. When that funding, was drastically cut by 60%, it was a real challenge here, not just for the healthcare systems and other mental health providers, but even what we're seeing in the housing and homeless world, what we're seeing in our jails, what we're seeing in the criminal justice system, because those individuals are not getting what they need from that just kind of that basic insurance policy, as you said. So. That is one of the things that our community has been grappling with, and I do think that it is, something that likely led to the passing of the millage. That when we were the safety net provider for 30 years, and then when our funding went away, all of our partners felt the ripple effect of that.
Huh. It's interesting, and it's a question I don't think people realize that it's not. We think of some of these services only for those in the destitution or you can get mental illness regardless of your economic status, it seems to me, and yet we don't, as a society, seem to have any consistent processing. But that does lead to something. I did go to your website and saw your strategic plan for 2017 to 2022. And I'd kind of like to get, obviously you've read that document, I assume more than once. And I guess I would, as a citizen in this community, what is the strategic plan of the Washtenaw County Community Mental Health Organization from 2017 to 2022?
Well, I'm really proud of the strategic plan. It really was a labor of love. It took us almost about 10 months to actually come to that plan. And the reason why I did is that we, the Community Mental Health Board and myself really felt that we need to make sure that we were getting input from, all of our stakeholders to come up with that plan. We engaged over 450 individuals, at least once, if not twice, on the development of that plan. So really, it is a strategic plan that came from, the community as well as the CMH staff. So. There's kind of four broad areas in that plan. The first one is, serving with excellence. And it talks about not just making sure that we continue to improve and do things that, we do better, but then also how do we work with our partners, and how do we collectively, with all of our partners, kind of lift the boat around mental health services. And so that is, one of the big areas of the plan. There's, a lot of emphasis in engaging our community and educating our community. I think the issues around mental health and substance abuse, there's still a lot of stigma attached to that. So there's a large part of the plan that is, really educating our community, our partners about what the challenges are and how we can all collectively work together to address those issues. There's also, our funding has dwindled year over year, and so there is also an emphasis in the plan on making sure that we are looking at how we maximize our current funding streams, and even diversify our funding streams. And so, that in part was also what kind of led to the millage. That would be an example, but it's not the only one. And then also a lot of emphasis in how we, continue to train our internal staff and our provider network that we also work with. That we really need to make sure that we all have the resources and the tools, and make sure that our staff have the resources and the tools to do their jobs well.
Well, that's important. You mentioned you serve 5,000 individuals in this county, and I'm kind of interested in who are these people? What are the populations that you serve specifically, dealing with what issues are they confronted with, and how do you determine, how do you lot them or differentiate between the different groups?
Well, we do a lot of outreach, and we do a lot of referrals. So community mental health is embedded in many of our systems. So we have, for example, in our youth and family program, we have very tight partnerships with particular schools that we know serve kind of at-risk or vulnerable youth. So we do a lot of identifying through outreach. We have, for example, a homeless outreach team that goes out to under the bridges and to the free breakfasts to really identify and find people that way. We, for example, also staff Judge Valvo's mental health court. So we might find somebody while they're going through the justice system. We are also the mental health provider in the county jail and the youth center. So we may find individuals that are going through those systems. And then we also have a crisis line that is actively used, and we can then, I help identify people who might need our services because they're in a moment of crisis. And then if they're not really need our type of services, then link them to a place where we think we could. So I'm always amazed that, community mental health really has its tentacles out in all over the community. And so we're really kind of an outreach-based system. But we certainly also have, active phone lines, for people coming in.
Oh, well, that's interesting. One of the reasons I wanted to have you on this program is because, as regular viewers know, we did have just a couple of episodes ago Sheriff Clayton. And as we are all aware, or if you've been following some of the local news here, we did institute, and the county did pass, or actually the citizens of Ann Arbor passed a millage, which was specifically designed to try to deal with this specific population. And as the sheriff was mentioning, he wanted to integrate the services at the jail with community mental health, and so that's why we have Ms. Cortes here. And I guess the thought is that now that you are going to found an additional source, hopefully, what do you hope to do with this increase in revenue from this millage project upcoming?
Sure. So, the Board of Commissioners did put a committee in place that is going to, based on the kind of 4 core areas that was on the millage, making kind of specific recommendations of how the funding will be used, and which will go to the CMH board and then to the Board of Commissioners as recommendations for their ultimate approval. I think right now, since it is an 8-year millage, the funding will begin in January of 19. The things are kind of high, on my list of things, is that there certainly is a need to stabilize some of the lack of capacity that we have, in part because of our funding, and so how can we kind of stabilize the system. Also, I think right now what we're experiencing here in Washtenaw County, which is quite alarming, is we are seeing a tremendous increase in youth suicide. So I think that there's a lot of work around prevention and education that needs to be done to help to start addressing that issue. Also, jail services. Right now we are seeing an increase in individuals with severe mental illness and substance use in our jail. We did a point in time count this summer, which found that I think about 70% of the population in the jail has one of those two issues, either substance abuse or mental health, or both. Many have both. So we really need to be more preventative at the front door and divert when applicable and when we can. And that a lot of that is about training our law enforcement officials, and then make sure that they're getting identify the needs if they do land in the jail. And most importantly, when they come out of the jail, make sure that they are still engaged in their treatment. So, and in addition to the, really being excellent at our jail diversion and reentry programs and treatment within the jail, there's a lot of conversation around crisis response in our community right now. That, in the example of law enforcement, if they come across an individual that clearly is in some type of mental health crisis, right now, law enforcement, depending on the situation, it might not really, they don't have many resources of what to do with that individual other than bring them to an emergency room or jail. And, and many times those are not the appropriate settings for that individual. And so there is some conversation of whether we need to, as a community, find a way to have a different location where an individual who's experiencing a crisis, that where we can kind of work with an individual to figure out over a 24 to 72 hour period of time of, is it really a substance abuse issue or is it a mental health issue? Figure that out, and then work to get that individual engaged in the appropriate care that they need.
One thing I think people are, and again it goes back to the stigma that you mentioned about people who have mental illness, and though statistically 1 out of 3 Americans will have it at some point in their lives. I think people are under the misapprehension that because someone's mentally ill that they're violent. There seems to be some strange correlation. Yeah, people do end up in jail for a variety of reasons, but is this population any more violent because of mental illness than any other population group that we have in our society, or is that just a perception that people might have about the mentally ill?
I think it's perception, and and it gets back to busting stigma that when someone's illness becomes so severe, they oftentimes lose their employment. They lose their employment, then they lose their job. When they lose their job, they lose their home. And so this population is one that I think that we need to work with so that it doesn't progress to a point without the proper supports that they need. I mean, I don't really believe that mental illness equates to a violent population. It's a population that has is facing many social determinants of health. And it leads them in places where I think anyone, under that type of stress, and one of the things that I think that I like to frame for people is that, getting back to stigma, is that, the human brain is an organ in your body, just like your lungs, just like your heart, and yet we still talk about mental illness not in the same way as we talk about asthma or congestive heart failure. And so until we can start identifying illnesses early and not let individuals, become so ill, we really need to have that community conversation and be comfortable with it.
Well, again, if you want to even just take this down to dollars and cents, Sheriff Clayton mentioned it costs $135 a day to house somebody at the jail, or $18 a day dealing with these various services outside of the system. just from an economic way, it seemed to me are much better at dealing with people than just having them in an institution that isn't designed the jail isn't the social service centers, but it's amazing how sometimes I think we as a society don't, you're dealing with funding issues, and yet we may be spending more money than in different areas that it's not really serving any purpose. But anyway, going back to the stigma and the concern of just people. One of the horrors that you've been mentioning is the reality that teenagers in this county, apparently, we've seen an increase in not just suicide attempts, but in actual suicides of young people. What is going on with these kids?
That's kind of the million-dollar question, because there's a lot of factors that could be contributing. Everything from bullying and social media, is one of the issues that come up. But there doesn't really seem to be linked to any particular geographic area or any particular strongly linked to any one demographic. And so it is a countywide, crisis. The public health data that I believe is through 2016 and doesn't include 2017 shows that over the last 5 years that there's been a 433% increase in youth suicide. So it is an alarming issue that we're facing, and there is no silver bullet to addressing it. And we're working with a lot of our community partners, with our particularly the schools, U of M Depression Center, several others, to really kind of come up with a plan of how to train staff, inform families, around these issues. So it starts with at least having education and awareness, and prevention.
Well, given that this is a crisis, an epidemic, I guess it would be for those watching, and I mean, let's say you have a child who's struggling in school, you're a parent, you're worried. What do you do? I mean, how do you know where to go? What would be the best way if you are a parent with a teenager, or even apparently preteens at this point that struggle, 10, 11-year-olds struggling with this? Where would you go, or how, and not to say, hey, my kid needs help? How do you do it?
Well, one thing, community mental health has a 24. We run a 24/7, 365 days a year mobile crisis team. So that is part of the work we have been doing. Is really as part of our engagement education of the community, is really making sure that people know that you can always call the community mental health crisis line. And that is, would be a great first place, because even if we we're not the service provider, we respond to anyone in crisis. Many times with law enforcement, many times at the schools. We will have a social work at the school call our crisis team and come out to the school. So it is community-based, and it is for everyone. And so that is, that would be a great place to start.
Yeah, well, that's amazing that we have such a growth in this, and of course this is a problem nationally as well with the opioid addiction. And I mean, there's a lot of problems we deal with as a society. Of course, you're on the front lines. I just get to talk about it, and we'll move on to something else. But this does kind of lead to something that you've had a long history. You started out in nursing. You obviously care about people, and you brought your family from one college town, the one I went to my first year in school at Boulder, to another college town. You're raising your family here. Mm-hmm. You're not leaving us, I assume, at this point. And now you're at the helm of this organization that's been around in Ann Arbor since the late 60s. Where do you want to see, and what do you want to accomplish, or your legacy in 5 years? Let's hope we're going to have you for 10 or 20. I mean, you're a young woman. So where would you like to see community mental health here in Washtenaw County through your leadership in, let's say, 5 years, something tangible? I'm not going to say you're going to have 100%, there'll be no more mental health issues in this county. I mean, that's statistics or whatever, but what do you truly, you're into this, this is your career. What do you want to say that you've done 5 years from now that you're most proud of?
Well, ultimately, my vision and our vision is, that we want to, improve the quality of life of individuals, with intellectual development disabilities and mental illness, and make sure that we are working to support and in conjunction with our partners that everybody meets kind of their fullest potential. So that's ultimately, kind of, my vision. But in the next 5 years, I think that really helping to, really bring all of the community partners together and continue to work collaboratively to, collectively work on these issues is, I think, a really big part of our role, because it's going to take all of us working in partnership to really reach that ultimate vision. So, there are very kind of specific things in the next 5 years are really continue to do the work that we're doing with our law enforcement in decriminalizing mental health issues and making sure that people are getting to the right place at the right time. Really working with our schools in early prevention and really see if we can certainly stop the increase that we're seeing and get people more connected. And I also think that working with continue to work with our providers, our individuals around making sure that adults with developmental disabilities or intellectual disabilities also are reaching their fullest potential. And so how we do that, with our families and our providers will be really, important. So, and then again, I'm making sure that we can, maximize and diversify and stabilize our funding. So that's what's on the short list.
That term seems to come up so often with you, and that is the whole concept of funding. How much of your time, it sounds like you spend all your time trying to find funds for all these projects you get. How do you deal with a budget cut, for instance, of did you say 60%?
Yes.
I mean, how do you plan for anything if you don't know where your resources are coming? I mean, this is how much of your time is devoted to trying to figure out ways of getting funding?
Quite a bit. So I, do work quite a bit, advocating in Lansing around issues that we're facing with Medicaid. We have done a lot of local and state advocacy around these issues, and also a lot of education for individuals that for their understand what CMH, the reasons why CMH can't do the things that it once did, and I think that. Kind of the silver lining, if you will, around our budget deficit is that people are now really understanding the role of CMH in our community. And I think that it really has led to lots of advocacy. And the perfect example is we passed a millage. And we are now the third county in the state to pass a mental health millage. So, I think that also just speaks, not just in Washtenaw County, but statewide, that all communities are experiencing what happens when mental health gets defunded, and so yes, advocacy around funding is a large part of my job.
Mm-hmm. Mm-hmm. Well, yeah, and again, I bet you'd prefer spending more time on programming and working with the staff. And I guess the good news, and this is for the citizens up on it, 70%. This thing passed with 70% of the vote, mm-hmm. So we are committed to this and hoping for the best, particularly with this population group. I want to thank you, Trish Cortes, for appearing again on A2 Insight. You do have some upcoming challenges, and part of that is getting the word out, and hopefully we'll be able to, with our viewers, to see that you're an advocate, a strong advocate for this and serving this population, and in conjunction with all these amazing, diverse number of providers that I just can't imagine the number of, well, I guess tentacles isn't the right word, but just the amazing different organizations you have to interact with, dealing with one individual. I can imagine how challenging it must be and hopefully rewarding, particularly when you see the successes. So I want to thank you once again for being on our program.
Thank you.
And until next time, I'm James Jost. This is A2 Insight. Have a good day.